Dr. Vidal, and we are back with Tuesday Tips. I am back in the office. I was on vacation for the last week and a half, so back to business and back to Tuesday Tips. So today we're going to be talking about what to expect brachioplasty. Why? Because I just put up before and after a brachioplasty and a lot of questions about the scar. So I thought it was a great returning from vacation topic to discuss what is a brachioplasty, where's the scar, why can't you see it in my before and afters? No, it's not a magic brachioplasty that I remove everything without a scar. There is a scar, but the position of the scar is what's important, okay? So we'll go over the types of brachioplasty, the scars, and then I'll get to answer your questions, okay? So brachioplasty is basically removal of excess skin and fat from the arms, okay? So it is what's called an arm lift. Brachioplasty is just a medical term for it. I know that is a very concerning topic in terms of the scar because it's an area that is very hard to hide. Whenever you're wearing a shirt or a small sleeve, like it's shown. So the position of the scar in a brachioplasty is extremely important to try to hide it as much as possible. It is impossible to make a brachioplasty, a long brachioplasty scar, completely unable to be seen, but depending on the position, we can hide it very well, okay? There are mainly two types of brachioplasty incisions. The traditional and most common one is from the armpit to the elbow, okay? And that's the majority of patients are actually candidates for that regular armpit, arm lift incision, okay? The armpit incision or the short brachioplasty incision is just, instead of being longitudinal in the arm, it's transverse or 90 degrees in the arm and it's hidden in the armpit. The point or the problem with this type of arm lift incision is it just takes care of a short length of excess skin in the arm and it doesn't take care of the majority of 2/3 of distal arm, okay? So if you do have just a little bit of excess skin just in the armpit, you are a candidate for that. But the majority of massive weight loss patients or patients with excess skin in the arms, the excess skin tends to go over almost to the elbow. And if you just take care of this, then you'll have an irregularity or a divot in the upper closer arm and then excess skin, which it looks worse. It looks like this is tugged in and then you have a bulge or excess skin in the distal arm, okay? So the majority of patients, unfortunately, are not candidates for that one and are candidates for the long one. Problem with that is the scar, right? Like we mentioned, where to put it so we can hide it as much as possible. The arm is a cylinder and the rotation of the arm makes that scar visible in certain positions. So where to put it to try to hide it as best is in the inner lower part of your upper arm. So I'm going to show you some pictures of my before and afters so you can see where I like to put the scar. This patient had moderate to severe skin laxity and this is the before, and you can see it's not only in this area, it extends throughout up to the elbow. So if I go ahead and do a small incision here and tuck that in, it'll make this flat and then this bulgy, and it's not going to look good. So she needed a regular or an arm lift brachioplasty incision. But when she's holding her arm up like that, you can barely see the scar. Why? Because the incision is not put in the inner part of the arm. It's not put up here. It's rather put in the lower inner part of the arm. So when she holds her arm up, you can't see it in the front. If you zoom in here, you can actually see the line of the scar there, okay? So when you look at my pictures, most of the pictures, if you zoom in and you pay attention, you can actually see the scar in the inner part closer to the armpit, right there. But then it curves and it's on the inner part there up to the elbow, okay? That helps not only get rid of that excess skin, but contour the entire arm to make it even. So it's not divot and then loose, but entirely contoured and tied and removing that excess skin, okay? So when she's holding it like that, you can't see it. When she's holding the arm on her side, you can't see it. But if she turns her arm and you're looking especially on the back, you can see it, okay? So it's important to know and to understand that this scar will be visible sometimes and in some positions. The majority of my brachioplasty patients are so happy to remove that excess skin and to have that improved contour that they don't care about the scar. And I think those are the perfect candidates to undergo the procedure. If you're still very self-conscious about the scar, then you shouldn't go ahead and do the surgery, because that scar will be visible sometimes, okay? And that's the most important part to understand, to acknowledge, and then to determine if it's so important that you don't see a scar, then don't get a brachioplasty. But if you are so concerned about your arms that you don't wear short sleeves, then what's the point, right? Then go ahead, get the better contour, and then we can treat the scar later on, okay? Let me show you some more pictures so you can see different scar patterns, different results. Same concept of that excess skin from the armpit to the elbow. You can see there, from armpit to elbow. You can see the groove where her muscle ends is right here. So all of this is excess skin. And then you can see a better contour, even contour, not divot, not irregularities, straight contour. And then if I zoom, same thing. You can see that the line of the scar right here, and then it curves to the bottom of the arm so you can hide it very well, okay? And this is an early result. You see that she has still some swelling and some bruising in the distal arm here close to the elbow. Another earlier result, excess skin in the entire upper arm, armpit to elbow, better contour, removing all that excess skin, incision in the upper part of the inner arm, so it goes from the axilla down here but well hidden. Similar result, and zoomed in, you can see the scar there, okay? Scar from here to here, but trying to make that even. So when you're with the arm like this, it's even and the contour of the arm is it's better. Excess skin from the arm to the elbow, and you can see the pattern that I'm showing, that if you remove that excess skin in the axillary area only, you won't have that better contour in the entire arm like you have with the scar, okay? Same, you can zoom in, you can see that scar there from the armpit, and then you stop seeing it because it's in the lower part, okay? So how do we treat this scar to try to make it thinner and less noticeable? And this is from the back. So most of my pictures here are from the front, but this is actually from the back. And you see, you can't see the entire, but if she goes like this and turns her arm, you will be able to see it as you rotate that cylinder of the arm and may expose that scar. But when you're like this, you won't be able to see it from the front or from the back, okay? Similar here, zoomed in, you can see that scar there, okay? So what things can we do to make the scar here heal as thinner and as nicely as possible? One of them is tension, okay? Whenever we apply tension to scars, that kind of pulls in on the wound healing that it's trying to seal it and makes the scar thicker or wider, okay? So at the early post-op period, you're gonna have compression. For the first week, the compression is like an elastic wrap, and it's important to apply that elastic wrap all day, even at night, okay? Especially at night, because that's when the swelling tends to worsen the most, okay? Also, the position of your arms, okay? If you're sleeping with your arms in the dependent position, you're gonna get a lot of swelling, especially in the forearm and hand, okay? So when you're sleeping, you should be putting pillows under your hands, so the arms and the forearms are a little bit elevated. You shouldn't be elevating it above shoulder level, because that, again, puts tension on the scar, but up to shoulder level so you have less swelling and that blood can return easier to your heart and you have less swelling in the extremity. The compression should be from elbow to closer to the armpit as possible, okay? And the amount of compression should not be too tight. If you tighten your upper arm too much, the swelling is actually gonna get worse in the hand and forearm, okay? So tight enough that you have good compression, especially when you're putting your arm down. The sleeve or the compression shouldn't be sliding down, should be tight, but you shouldn't be stretching it too much, that making that arm tight too tight for then the blood to have resistance to go to circulate back to the heart, okay? After the first week, when I see you on the follow-up, if the incisions look good, then you can switch to what's called a sleeve, okay? It's like a sleeve that's elastic, and that's easier to put. It puts some tension when you're putting it on, so that's why I don't like you to apply it the first week. We want that scars to heal a little bit before we start to put the sleeve. And then at a week out, you can start with the sleeve if everything looks good. The sleeve you're gonna use for 6 weeks at all times, okay? It's the same, trying to keep that swelling down until 6 weeks. After 6 weeks, you wear it for 12 hours a day until 3 months out, okay? So for a total of 3 months, you're gonna be wearing some type of compression or improving that swelling, okay? The elevation should be for at least 2 weeks, which is the initial post-op period where the swelling is the worst, okay? Diet is important because if you eat salty, you're gonna get more swelling, okay? So try to limit your salt intake to low, okay? So trying to avoid massive swelling. Another thing that's important, like I mentioned, is the position, elevating the arms, but not too high to apply more tension on the arms. No exercising, no heavy lifting for 6 weeks to try to avoid stretching that scar. Scar treatment. At 2 weeks, you're gonna start to apply silicone-based scar products, okay? So it comes in a gel or it comes in a tape. Both are equally effective, but you should start at 2 weeks. 2 weeks, you start this consistently for 3 months at least, okay? So 3 months consistently. If you can do 6 months, even better. If you can do up to a year, that's optimal, okay? Avoiding UV light. So
3:30.
Oh, okay. I'm like, what? Sorry. So UV light avoided for at least 1 year. All of those things are going to contribute to try to make that scar as healed, as thin, and as nicely as possible. But scars tend to get darker and redder before they get better, so you have to be patient, okay? So up to a year, scars tend to change a lot. So if you see that your scars are very thick or are red or are dark in the initial first 3 months, you have to wait. Continue to be consistent with your scar treatment. Continue to be consistent with avoiding UV light and wait. You can start massaging your scars at 6 weeks post-op to try to soften them. That's also important. If you're getting thick or tight scars, you can start massaging it, and it takes time for it to soften. All of those things, but also your genetics, how you heal, also play a role, okay? Trying to make this scar heal as nicely as possible. I understand the importance of it because it's a scar that is shown more than any other in our body. But at the end of the day, time is of the essence, and we have to give time for our bodies to heal and see a final result. I'll get some questions now.
The first one said,
Yes.
I'm really interested. How can I book a consultation?
Very, very easy. So if you go to my page on Instagram, there's a link and you can click it and that'll connect you to our website. If not, pureplasticsurgery.com. You go to our website and the first thing that will pop up, it's called virtual consultation. And you would think, I don't want a virtual consultation, I want to get a quote. It's just a process, okay? You go there, you click it, it'll pop up a form. It'll ask you a few things that are important for me to determine what surgery is the best for you and to give you a quote that it's the optimal for you. So that and some pictures, which is important for me to evaluate your case, okay? Once I evaluate it, a coordinator will give you a call and she will go over the quote and all the details of the surgery.
How I know if I need body tight to the arms or an arm lift?
Very good question. So, and a very good, a common question patients ask, okay? So what's body tide? Body tide is radio frequency energy combined with liposuction. It can help to tighten and remove that excess fat and improve the contour. If you have mild skin laxity, then it's better to do lipo and body tide, and that's gonna improve the contour. If you have moderate to severe skin laxity of your arms, then it's weighing the benefits and the cons. So benefits of the lipo with body tide is that the scar is just a small scar near the elbow, is not the scarring as the brachioplasty. But the results are not as dramatic as the brachioplasty, okay? You're gonna have an improved contour, but that excess skin is not removed, so you'll still have some loose skin, especially in the severe cases, okay? For the severe cases, if you want to see an improvement, it's better to do a brachioplasty. For the moderate cases, I just weigh the risk and benefits and what are your goals. If you're trying to avoid a scar and you're okay with just an improvement still with some loose skin, then body tide is a good option. If you really want all that skin and tight as possible, then a brachioplasty is better for you.
I have a BBL procedure with you in 3 weeks. I'm looking forward to it.
That's
Just
awesome.
to make sure how long until I can drive again.
So very good question. You can't sit for 6 weeks, but you can start using the BBL pillow 2 weeks post-op. The majority of my patients are able to drive with the BBL pillow. Just try to keep it safe, okay? So try to see if you can fit in your car, depending on the size of your car. Try to, if you can reach, if you can have a good control of your car, then 2 to 3 weeks is good. If not, the safest is to wait 6 weeks so you can sit without the BBL pillow.
Okay. A brachioplasty can be combined with a breast augmentation.
Yes, ma'am. A very good combination is with a breast, and it also can combine it with a full mommy makeover, breast and tummy tuck, and doing the arm lift or the brachioplasty, very common. With lipo cases, it's usually not good to be combined, but when I'm doing the brachioplasty, then I have a limit of 1 liter to be removed with the liposuction, okay? So if it's a small area of liposuction, let's say just the belly or just the inner thighs, you may combine it with brachioplasty, but if you're looking for a lipo 360, for example, or more, or a BBL, then it's better to do it separate.
Okay, how long is the pre-op consultation?
The pre-op consultation, it usually takes like an hour, okay? You should plan to be here for like an hour or 2, okay? Why? You say, why so long? We do a lot in that pre-op. We take your pictures, we go over all the consents of the procedure and anesthesia and all the consents that we go through. You also get to meet your surgeon, you get to meet me. We talk about your goals, expectations, I examine you. And all of that can take up to an hour, maybe a little bit longer.
Okay, do you see patients with lymphedema?
Usually no, it depends on the degree of lymphedema. So lymphedema is swelling on your legs because your lymphatic system, it's not working well or properly, okay? Depending on the severity of the lymphedema, it can happen in the arms as well, especially for patients that had axillary dissection with breast cancer, for example, or radiation to the axillary region, and they have swelling in the arm. So depending on the severity, there are some surgeries that help improve the symptoms, okay? For those patients, I did my training at the University of Miami, and the University of Miami has a very, very good program for lymphedema patients. They have a multidisciplinary team, including lymphedema specialists, surgeons, physical therapists. So if you're a patient with lymphedema, I do encourage you to check the University of Miami Lymphedema Group, which is a very good alternative.
Okay, the last minute, please tell us about the surprise we are having tomorrow and to be engaged with all on social media.
Yes, so tomorrow, very, very big announcement during Hump Day Live with Dr. Earl. So we're gonna be, you've been listening and hearing that we have a lot of new things coming up to Pure. We have a new association with a pre and post-op team that helps you through the journey. We have association with a hotel if you want to to add that to the package. And we have a new surgeon that's joining our family. And tomorrow you're gonna meet that surgeon. So don't miss it with Dr. Earl, Hump Day Live tomorrow. That's it, you guys. Thank you so much for joining, for your questions. Hope this helped answer some questions, and a lot of the comments were like, I want to see the scars, I want to see the scars. Well, the reason is because the scar is in a good position so you can't see it. It's not because I'm trying to hide it, it's because it's in a position that it's not shown when you are flexing your arm. So if you have any questions, message me, and if not, I'll see you next week, Tuesday Tips. See you.